Hi, I'm Dan Johnson, Associate Professor in the IUPUI Department of Geography. My research tends to focus on social and environmental vulnerability and the health effects of climate change and other human impacts on the environment. The COVID-19 pandemic has underscored and hopefully brought into the public consciousness the heightened effects witnessed in some of our more disadvantaged communities, both locally and globally, which shows the scale of this issue. Many of these communities are what we consider socially vulnerable. And social vulnerability implies an inability or lack of capability in responding to an external stressor, such as a heat wave or a pandemic. Complicating matters is many of these communities are overlapped with areas we would consider environmentally vulnerable, meaning the environment is more prone to certain types of events that would affect human health. A good example of this would be the urban heat island effect in cities or areas more prone to flooding, things of that nature. My research focuses on both of these broader concepts of social vulnerability, environmental vulnerability, and how they interact, and we work towards modeling the effects of this. So we use a variety of data sources from NASA, there's miles in space, down to fine-scale private health information, and all data sources and scales in between. These are placed into machine learning and artificial intelligence algorithms where we work to predict the effects at very fine spatial scales. And what this allows for is intervention before an event, so to where we can prepare a community for something, some impending event, or work to increase resilience and lower vulnerability in these locations. What really drives me in my research and sometimes leads me to spend days on end behind a computer is that many of the health effects we witness in these communities are preventable. And if we can develop models which forecast these effects, we can work beforehand to intervene before some sort of event. And just as Ben Franklin said in 1736, as Philadelphia was burning, an ounce of prevention is worth a pound of cure. In our computational world, as we can model many things, a byte of prevention, B-Y-T-E, is worth a gigabyte of cure.